right, we'll move along with our curriculum. Our next presenter is Stephanie Ann Girard, representing SGS Nutrasource. We want to thank SGS Nutrasource for underwriting this session, and it's about measurement to meaning, practical approaches to healthy aging outcomes in clinical trials. Stephanie Ann, the virtual stage is yours.
So thank you so much for giving me this opportunity to present today. So basically, my experience and expertise lies in clinical research. So this is the angle that I will be taking today and kind of looking at healthy aging and what it means in terms of considerations that you should take when conducting your clinical trials and how to interpret results from healthy aging clinical trials. So brief agenda, just introducing healthy aging, some hallmarks of aging, as well as biomarkers. So things you should consider measuring in your clinical trials, some surrogates of biological aging as well. So I'll talk about frailty and intrinsic capacity. And we'll talk a little bit about gut microbiome, specifically in healthy aging and what it all means. I'll just very briefly touch upon one slide on certain animal models that exist in terms of preclinical. How can you look at healthy aging? How can you screen some of your ingredients, in a quick and dirty model to be able to inform candidates to then take them into the clinical trials? And again, interpreting these outcomes, what do they mean? What to consider when you're designing your trials. And I like finishing up normally by just looking at what is currently ongoing, the studies that are running currently, and what to expect in a few years when these trials are over. So you probably have been hearing this quite a lot over the past couple of days. So aging is a universal biological process. However, the speed and the quality does vary between individuals, and that's important, especially in the context of clinical research. Biological aging involves an accumulation over many, many years of molecular and cellular damage. And basically, when we think about healthy aging, of course, we want to maintain function and across different domains. So you want to look at physical function and mobility, cognition, cognitive health, very important. Endocrine, metabolic, immune resilience, and just overall well-being and quality of life. And I think that's very important in the context of clinical research, looking at healthy aging. So it's not only about living longer, but it's about living longer better. So important to have some of these aspects when conducting clinical research. The definition of the WHO of healthy aging, you've probably heard this before. So it's the process of developing and maintaining the functional abilities that enable well-being in older age. And as I mentioned, aging is very heterogeneous, and thankfully it is modifiable to a certain extent. So you can modify the speed of aging and the quality of aging with lifestyle intervention, with the environment, with nutrition, and you can, to a certain extent, influence the trajectory. So what are some trends, opportunities? So it's probably no big news that there is a global demographic shift occurring right now. So increasingly more proportion of older adults. It's been reported that by 2030, 1 in 6 people, so over 1 billion people, will be over the age of 60 years old. And over 80 years old, the numbers are expected to triple in the next 30 years or so. So there is an economic impact. If healthy aging is not maintained, there could be cost to healthcare and long-term care. So there's definitely an opportunity window. As I mentioned, to a certain extent, aging is modifiable. So again, nutrition, lifestyle, supplementation, and also microbiome, which I'll touch upon a little bit in future slides. So there's definitely a growing interest in clinical trials that are targeting healthy aging, looking at functional outcomes and also validated biomarkers. And clinical evidence is really important to differentiate products on the market with healthy aging claims, whether it's a structure function claim in the US or health claims in Canada. So this will really support your product and be a big return on investment after your clinical trials. So here, I just wanted to present a few hallmarks of aging. So those are fundamental cellular and molecular processes. And basically, what's important to note is that some of them are interconnected. So genomic instability, telomere attrition, and mitochondrial dysfunction, they actually interact and they do amplify each other over time. These hallmarks are potential targets for intervention. So again, nutrition, lifestyle, all of these can aim to maintain or improve intrinsic capacity, and I'll discuss this a bit later. And very importantly, the early changes in these hallmarks will precede the symptoms. So often these changes are happening, but you have no clinical, change. So it takes time before you see these impacts clinically. And so prevention and midlife intervention could actually be good options, especially if you're thinking about a clinical trial and the age of your population, your participants. You may want to start your intervention midlife to see some of these things modify or being able to be changed. So these hallmarks are very important, and they actually do influence things like mobility, cognition, vitality, metabolic health, and resilience. And these are all things that we like to measure also in the context of clinical trials. I'm showing this was from a recent-ish paper in 2020. I really like what the authors put together. These are basically different biomarkers of aging that you can measure in the context of a clinical trial. So you have biomarkers of physiological function. So you can measure blood pressure, blood lipids, again, fasting glucose, HbA1c that we heard from the previous speaker. So these are things that you can measure. You can also measure endocrine function, so looking at the HPA axis, some growth hormones, and then you can really look at physical capability. So you can look at strength, balance, dexterity, locomotion. Cognition is another big one, so looking at memory, executive function, and also immune function, immunity with the immunosenescence happening as a natural process. So you can measure these things pretty easily in the blood. And these are done a lot in the context of clinical research. So I really like the way that they kind of summarize everything that you can look at when looking at biomarkers of healthy aging. And so in terms of physical function as a biomarker, so some of the things you can do in the context of a clinical trial is you can look at performance and mobility. So some of the tests that you can include in your trial is a timed up and go, and these are validated tests that you can do. So time up and go, so from a sitting position to standing, walking 3 meters and coming back, and time how long this takes. You can do other tests to look at gait, balance, strength. You can do another walk test, a 6-minute walk test. So have the participant walk for 6 minutes and look at how far, they walked. And so that evaluates physical performance, endurance, mobility. Another one that's used quite often in the context of healthy aging clinical trials is the grip strength. It's quite straightforward to do, and it's an indicator of overall strength and medical status. So it's measured with a dynamometer, and it's used quite often in the context of clinical trials. Okay, so I want to touch upon 2 constructs or surrogates of biological aging. So frailty. So frailty has been used in the context of clinical trials. It's the state of increased vulnerability. It's a decline in function across multiple domains, and it actually is associated with being able to predict mortality and adverse health outcomes. So you can actually use diverse operational instruments to measure frailty. And there is something called a frailty index. So frailty index looks at symptoms, fatigue, poor sleep, some signs, again, the grip strength. It looks also at chronic disease, functional impairment, again, measuring things in the blood, such as inflammation. And it does also consider cognitive issues, so cognition, memory, and these types of things. So there is an index that exists that could be used. It's called the frailty index. Another construct is intrinsic capacity, and it's a surrogate of biological aging. It's derived from a public health framework, and it looks at prioritizing the person's capacities and reserves, and it promotes a positive vision of aging. So there are 5 domains in this intrinsic capacity, so locomotion, cognition, vitality, sensory, and psychological. So 2 different constructs. And they both have strengths and weaknesses. So when you're looking at frailty, It's actually a well-validated surrogate. It's been used, for decades. As I mentioned, it does predict mortality, hospitalization, disability. It is strongly associated with biological aging pathways, and it's highly responsive to stressors. So it is quite useful to have this index and to measure frailty in intervention trials. But the weakness is that it often reflects a late stage decline. So it may miss the early changes in aging. And there are many frailty tools that exist. So when trying to compare across different clinical trials, it's quite difficult. And some of the components are subjective. So exhaustion is an example of this. And it will be less sensitive in younger or healthier population. In terms of the construct intrinsic capacity, it's more holistic and domain-based, and it can capture early aging before those clinical deficits. It can either be used in younger, old, or healthy population. It integrates physical, cognitive, and psychological function. It's WHO endorsed, and it's suitable for multidimensional interventions such as nutrition intervention, exercise, or cognition. But that being said, it is newer, so it's less validated. The cutoffs as well have been less validated. They differ between the different trials. It does require more excessive or extensive assessments. And again, since it's newer, the responsiveness to change is still being characterized and evaluated. So now that I mentioned the strength, the weaknesses, so which one should you be using in your clinical trial? Well, if you're thinking of frailty, you may want to consider using it in a trial that recruits older adults greater than 65. If your intervention is looking at resilience, sarcopenia, so the loss of muscle, inflammation, that's when you may want to use this index. If you're looking at meaningful changes within short time frame, it would be a good construct to use. But that being said, you do need a standardized definition. The baseline will influence the event rates, and there may be ceiling effects, especially if you're looking at a healthy older population. So when do you want to use intrinsic capacity? So you can use it with healthy participant midlife or healthy older adult population. And again, starting to look, at healthy aging, but at a younger age. So if you want to look more at prevention, that's a good tool to be using in your trial. It's multi-domain again, and it will detect trajectory shift in aging. But it is complex. Again, there needs to be clear scoring, and you may need to have a longer trial to be able to see a change. But it is more sensitive to small improvements. So different contexts, different possibilities, things to keep in mind, depending on your population and what you think your ingredient or your product is doing. So now both of these constructs, frailty and intrinsic capacity, do have a link with gut microbiome. So that's what I wanted to briefly discuss. So healthy gut, in the green, eubiosis, we know that through life, your gut microbiota will change, and different things will influence the change of your gut microbiome. So for example, vaginal delivery, breastfeeding during young infancy or childhood will impact your microbiota in a positive way. Being exposed to stimulating your immune system will also have some positive impact, and high physical activity. And it promotes a higher, healthier intrinsic capacity trajectory. So you can see that a healthy gut microbiome will lead to an increase in the curve of your intrinsic capacity, and that will be maintained through different life stages and even into adulthood and old age. The opposite, unhealthy gut, so dysbiosis, which is normally linked to C-section, the mode of delivery, formula feeding during infancy, poor lifestyle. This will in turn, lead to lower short-chain fatty acid production, and it's actually associated with poorer intrinsic capacity over time. So you would see, it would be more correlated with the red line in the bottom of the graph. Now, what about gut microbiome and frailty? So these are some of the domains of frailty that I listed off: inflammation, cognition, muscle, fat, and bone. And they've been linked actually to the gut microbiota and to a certain extent the dysbiosis. So we know that dysbiosis will increase gut permeability and decrease the short-chain fatty acid production. And this will in turn drive chronic systemic inflammation and will accelerate frailty. Another domain, cognition. So we do know it's been shown that dysbiosis will disrupt the gut-brain axis and contribute to cognitive decline, mood changes, and decreased neurological resilience. In terms of muscle, another domain, dysbiosis will decrease nutrient absorption and short-chain fatty acid availability, which will in turn worsen muscle strength, mass, and function. And then in terms of metabolic health or fat, dysbiosis will promote visceral fat accumulation, insulin resistance, and metabolic inflammation that feed into the frailty and the frailty index. And then bone, another domain. So it has been shown that dysbiosis will in fact affect the calcium absorption, immune signaling, and increase the risk of fractures and bone loss in the long term. So there is a link between these constructs and the gut microbiota. So, when conducting your clinical trials, looking at healthy aging, I do recommend that you do look at gut microbiota. Whether or not your ingredient modulates directly the gut microbiota or indirectly, it could be a mechanism of action by which it's impacting healthy aging. So I really like this figure just showing, the different life stages and how certain external factor can impact your microbiota. So from the infancy, even in the womb, the maternal diet, the dietary habits, or the use of antibiotic by the pregnant mother will impact potentially the fetus, the baby, the child, and all the way to the elderly. And in terms of elderly, some really important factors to consider that may impact the gut microbiota is hospital stays, infections, medication. This is a population that takes a lot of different medications, so this will in turn have an impact on the gut microbiota. We know as we age, our diet changes as well. There's decreased intestinal function, slowing of the GI tract, and also naturally a reduced exercise. So all of these factors will influence the gut microbiota, and so I think it's important to measure this. One interesting thing is that you'll see the bacteria typically in the gut will change. You'll have a decrease in bifidobacteria. But what I wanted to point out is that an interesting population to study is centenarians, because they actually have a very different microbiota whereby you see a significant increase in Akkermansia muciniphila in these individuals. And this brings me to my next slide, because there's also an opportunity when looking at healthy aging or aging in the gut microbiota to study these centenarians. And what makes them so special, because of the aging population, will have a bigger pool of these people. And so Italy, I was unaware, but Italy has actually one of the highest centenarian population per capita in Europe. So I just wanted to show two studies that were published actually a little while ago, looking at these centenarians in Italy. And there was no intervention in these cross-sectional studies. But they did find that in one trial, they found that there was more diverse core microbiota than the young and elderly and the centenarians. So they had, greater levels of Bifidobacterium adolescentis. And then in the other study that they looked at, they saw that the centenarian had, there was similar microbiota between the young adults and the 70-year-old, but differences in the centenarian. They had a very different microbiota. So it's going to be interesting to see with the aging population to look at this pool of participants and see how their gut microbiota differs. And maybe if you can show that your ingredient or your product, shows some of these improvements, maybe it can link to longevity in a certain way. So, and then two other trials that I just wanted, to mention in relation to gut microbiota and aging. These are actually a trial that are ongoing right now. Either they just finished, so active, but not recruiting anymore, or they're about to start, not yet recruiting. And I found it interesting because there's a lot of research being done in healthy aging right now. in the US and in Europe on the gut microbiome look with postbiotics. So these are two postbiotic trials. Short intervention, though, only 8 weeks and 12 weeks, but they're looking at cognition, they're looking at fatigue, grip strength. So interesting to see what's going on right now in the postbiotic that's blooming in the healthy aging health segment. So this is my slide on the preclinical. I thought it would be interesting maybe for some of you to consider prior to going into the clinical trial, which is quite a big investment. If you have a few ingredients and you want to be able to determine the best candidate, you can actually use some preclinical models to screen for the best candidates. And I list a few models that you can use. One that's really interesting and I've used in the past myself is a C. elegans model. So it's a nematode, basically a worm. And it's a good model to look at aging. It has a complete gastrointestinal tract. And so you can put in the media of the worm. In this case, it was looking at probiotics, but you can put other ingredients in the media and you can look at different aging hallmark and being able to screen the best candidate to then take that ingredient into a clinical trial. So I just thought it was noteworthy to mention. Often we're unsure of which are the best candidates or the combination of candidates before going to a clinical trial. So you can use these screening tools or mice model, rat models that you can use that look specifically at some hallmarks of aging, and that could help you inform which test product, which ingredient to take to the clinical. Okay. Interpreting outcomes, very important. So when you run a clinical trial, basically you want to ask some questions, and hopefully you do that before the trial. But basically you want to make sure that what is the nature of the outcome? Is it more biological or is it more functional? And is it meaningful? What's the gain in health, or does it have an impact on the quality of life? Small gains may not translate to really functional improvement in older adults. So you need to ask yourself these types of questions before you go into your clinical trials and design your study. Trying to, look at causes versus association. So the nature aging itself, it's still being, studied, understood. And again, like if you're looking at biomarkers in the blood, so very specific cell-specific aging, does that reflect the organs in your body and the impact that your product has holistically? Are the outcomes in the questionnaires that you're using validated and appropriate for an older population? So maybe validated in an adult population, but what about the older aged adults? And so I did a little research and I looked at some of these often used questionnaires in clinical trials to see, are they really validated if you're looking at an older adult population? And so I just put down a list. For example, if you're looking at frailty, physical function, you have some of these things that are validated for this older population. For cognition as well, you have the MOCA, you have a few of them to look at mental health, nutrition, quality of life, which is very important. So when you're choosing I guess the takeaway from this slide is when you're using a validated questionnaire for your clinical trial, is that validated questionnaire validated for older adults? And the answer is not always yes, even though it's validated in adults. For example, these are validated questionnaires that may be less a good fit for your population. You can have recall biases. You can have age biases. It can be less specific with older adults. You can miss some specific domains that are more important for, an older age group. If you're looking at visual analog scales, which are those either 100 millimeters or 10 centimeters line, asking participants to, answer a visual analog scale. For example, if you're asking about appetite, well, for a population that has less coordination or motor control, are they able to replicate each time at the same accuracy if you're looking at changes, in appetite and you're using a visual analog scale, right? So these are the types of things to consider when you're studying an older population. As well, more and more, we're the previous speaker was discussing this, wearables. Is this appropriate for aged adults? Is there any digital literacy barrier? Should we, use more of the paper-based questionnaires or, the apps? I know a lot of us have, smartphones, but if you're studying, 90 years old, maybe they don't have access to that technology. So again, defining healthy. So in the dietary supplement, natural health product, you want to recruit healthy adults or healthy participants, but a healthy young adult is very different than a healthy aged adult. Often healthy aged adults have comorbidities, chronic conditions. So how do you take those into account? Are they covariates in your model? These participants often take multiple medications. So is there any risk with, their medication and an interaction with the nutrient or the supplement itself? And then you don't want to be too stringent either, because then if you don't permit these comorbidities or this population into your study, then you'll have some issues with recruitment, right? And as most studies, even in younger age, you have to consider the whole person, right? So you have to consider some covariates like sex, ethnicity, social economic status, lifestyle. And these participants that are aged adults, they have exposure to lifelong factors, right? They've been exposed for decades upon decades to different diets and stress. So that will be a big variable, and that will actually impact the baseline. And the baseline of individual will be quite different. So it's going to be harder when you compare groups or you compare interventions, because they don't start at the same baseline. They've been impacted by these factors for decades. And again, being careful for this particular vulnerable population to not underrepresent them, because a lot of them will live, remotely, rural, or again, the social economic status, they may be, has to be taken into account when you're recruiting this population. And just thinking about safety and tolerability, which are often measured in clinical studies. So do those safety thresholds have to be adjusted? For example, an event that is tolerable for, a middle age, 40 to 60, maybe it's unacceptable for somebody that's much older, right? They may be more sensitive to gastrointestinal effects. And again, like the interaction with their existing medication, the comorbidities, and, your intervention itself. So safety and tolerability, you may want to measure it differently for this particular population. And then coming back to choosing the right outcomes that are actually meaningful to aging and to them. So I know I mentioned quality of life. That's very important. People want to live longer, but they want to live, a healthier life. And then there may be slower physiological changes that you may want to consider, and you'll need sensitive or composite endpoints for those. Again, making sure that the tools you're using are validated. And there may be actually risks of ceiling effects or floor effects if you're not using the right tools for this population. So there's a lot to take into account if you're doing clinical trials in healthy aging, because this population is very different. Just in terms of like the study logistics, the visit burden. So these people may not have access to transportation, right? They may not be able to travel. So you may want to include like home-based visits or hybrid assessments, being able to accommodate for decreased mobility, right? So, and when they come in the clinic or at the site during a clinical trial, you may want to have larger font, hearing-friendly environment, not a loud environment where they'll have difficulties hearing the instructions that are being given to them, right? And then retention strategies, you have to make sure you touch point with them often. Will you be doing with phone calls? Will you visiting their homes? So all of these logistics need to be adapted to the study because the population is different. In terms of the intervention itself, in terms of your dietary supplement, being conscious and cognizant of, the population and the fact that they may have difficulty swallowing, right? So what's a dosage form? Are you giving it in a capsule, a tablet? Is it going to be a chewable? Packaging, if they're going to have sachet, how easy it is for them to open the sachet. The timing, are you going to want to time it with their meals? And if they take a lot of medication, you have to take that into account too. A lot of them are very stuck to their routine. So what are you going to do to ensure that it's part of their routine so that they don't miss any dosing during the trial? And also if you have like very complex instructions in terms of dosing, that may be in terms of a cognitive load that may be harder for them to respect and to uphold. And then you don't necessarily want to avoid older adults without strong justification. I know for the ethical board, that's going to be something that they're going to look at. You have to make sure that when you are administrating the informed consent, again, larger font, making sure that cognitively they're able to consent to the trial. That's another tricky part, especially if they're older. And again, making sure to include diverse aging population. So all of these things must be considered, in the context of your clinical trial if you're recruiting an older population. And then, as I said, I like to do this normally at the end of the presentation, just to give a snapshot of what is happening right now. So in this case, yesterday I went on clinicaltrials.gov, and I wanted to look trials that were active, not recruiting. So those are, most of the time, those are trials that just finished recruiting their participants, but that are not published yet, right? The participants may still be going through the intervention. I looked at trials that were recruiting or trials that were not even yet recruiting. So brand new trials that were registered on clinicaltrials.gov. And I was looking at the keywords aging well, geriatric health, aging process. And I looked at specifically older adults, 65 and older, and healthy. And so I found 539 studies ongoing right now. And this is including drugs as well. So this is drugs, dietary supplement, natural health products. But still, I thought it was interesting to see that there's a lot of trials ongoing right now with an older population. There's 393 of those that are interventional. And when I looked at kind of like the categories or the types of intervention, so I would say like the majority were cognitive, neurological health. You had a lot of musculoskeletal, physical function. Metabolic health was another big one. You had some on menopause, osteoporosis, and also skin. So a lot of clinical trials ongoing right now, looking at wrinkles, hydration, and these types of things. So I just thought it was interesting that a lot of clinical trials are ongoing right now, looking at aged adults and healthy aging. So basically, few takeaways. Aging is universal, but as I mentioned, the rate and quality of aging, it does differ amongst people. It's a good opportunity, though, for targeted intervention. So nutrition, as I mentioned, lifestyle intervention, or even dietary supplements. There are more and more biomarkers and functional constructs that are now advancing how we measure and understand healthy aging. But it's tricky because aging is a big concept and it affects multiple domains. So physical, cognitive, metabolic. So the results have to be interpreted through a multidimensional lens. So something that may be, and I say this often, something that may be mathematically, statistically significant may not be clinically significant. So really, at the end of the day, it's how you impact people, their daily lives, and their quality of life. So that was my last slide.
Thanks very much, Stephanie Ann. Great presentation, really gives us the breakdown on some clinical considerations. The big issue with clinicals from a practical standpoint is what does it enable you to say from a claim standpoint? So obviously we're talking broadly about aging and healthy aging. You had the hallmarks of aging a little bit earlier there. Talk a little bit about converting the clinical to claim strategy in this area specifically.
Yeah, that's a very good question, a question we get often. I think what's important to keep in mind is that aging, it's a natural process, right? So you are limited as to what you can say. I think structure function claims in the US, you're even more limited as to what you can say. And then also as to what you want to say, right? I mean, you can have a really well-designed, scientifically, like really interesting study that looked at DNA methylation or telomere length, right? And you get excited. It's a hallmark of aging. But then how does that translate into what you put on your label and how consumers connect with that, right? Like, do they understand what that means? Probably not. So yes, I think it's important to connect with what consumers want And again, if you already have a claim in mind or something you would like to say, it's good to kind of work backwards from that and ensure that you measure the right things within your clinical trials. Because sometimes if you get too scientific, the message will be lost. Consumers won't connect, and yeah, it's a shame when that happens.
Understand. Okay. All right. We are out of time. But I do want to thank you, and thanks for SGS Nutrasource for underwriting that session.